And Singapore joins other authorities across Asia on high alert after Chinese health officials confirmed the virus could spread through human contact. 15 medical staff treating infected patients have been diagnosed. And to date, more than 300 people in China have contracted the virus, with 6 deaths reported in Wuhan. Airports in Asia, Australia and the United States have introduced mandatory screenings for passengers arriving from Wuhan. And those who present pneumonia-like symptoms will likely be quarantined. The mysterious illness continues to spread across China, and this evening, Taiwan confirmed its first case of the virus. Patients in Thailand, Japan and South Korea have also been diagnosed. Now, as millions of Chinese are traveling this week for the Chinese New Year holiday, there are fears that the virus could spread even faster. Scientists at the University of Hong Kong estimate the virus outbreak has already spread to 20 mainland cities and that thousands of people could already be infected.
Our best guess in terms of the mode, which is the most likely number, is somewhere in the region of 1,300 plus. So it is absolutely critical that public health authorities recognize a super spreading event in the very earliest stages, before it goes absolutely explosive.
And joining us tonight is Professor Paul Tambyah from the Department of Medicine at NUS Yong Lin School of Medicine. Thank you very much, Professor, for coming in. So this case has increased, we know, substantially over just this last 2 weeks, with 6 being reported dead so far today. Given the number of infected and the upcoming surge in travel because of Chinese New Year, how severe are we expecting the situation? How worried should we be?
Well, I think it's going to be really hard to tell. You know, the best case scenario would be that every city which has been affected by this, the public health authorities get their act together and they manage to keep it under control. In the worst case scenario, this becomes something like H1N1 2009, about 10 years ago, which you recall, spread very quickly all over the world. The good thing was that that was a relatively mild infection, and hopefully this one might turn out to be the same.
We've got confirmation now that human-to-human transmission is possible with this virus. So what does this mean in terms of just how quickly we might see this spread, though?
Well, the big difference is when it was originally from animal to human, you'd have to have contact with an infected animal. And you know, that's relatively easy. You shut down the markets and things like that. But the trouble is that the coronaviruses, they have a very large genome. So they are RNA viruses. That means that they have the ability to mutate. And it sounds like what might have happened is that the virus may have acquired the mutation, which allows it to transmit easily between humans. So this is a concern, but again, as I mentioned earlier, if you get good public health in action, then hopefully you can contain it.
Okay, it's mutated. It now, you know, can jump from human to human, but do we know how it's doing that?
Well, I mean, if you're talking about the physical way it's transmitted, most of these respiratory viruses are transmitted by droplets, and that's what the WHO is saying. And so that means if you cough or sneeze, and if you're sitting 3 feet away from someone, then you can transmit the infection. But, you know, it's not 100%. No respiratory viral infection is 100%. You know, if somebody in the office has the flu, half of the people in the office will get the flu and the other half will not. And it's completely random as far as we can tell.
Is there an incubation period to this as well?
Yes, as far as we can tell from the data from the cases that have occurred outside of China, it's about 4 to 7 days. But, you know, with some of these viruses, it can be prolonged as long as 14 days. And so that's the parameter that is being used in the MOH recommendations.
Professor Tambyah, the big concern for many people is the comparison to SARS, that outbreak that we saw back in 2003. But when you do put these two coronavirus side by side, how deadly is the one that we're seeing now?
Well, again, it's way too early to tell. You know, if you look at the genes and the genetics of the two viruses, there's about 80% of the new virus that's similar to SARS. It's from the same sort of family and genetic group. Both of them are thought to have come from bats. But remember, SARS came and went very quickly with no drugs, no vaccine, just simple good public health. And SARS disappeared from the face of the earth 17 years ago. And apart from a few sporadic cases in the market the year after that, we haven't seen SARS anywhere in the world since 2004. And it's not because we haven't looked for it.
So for those that will be traveling, you know, let's get back to the point of, you know, it's Chinese New Year period,
Sure.
everyone's going to be traveling. What are some of the symptoms that, you know, we should be looking out for? Because, you know, we mentioned that it jumps, it has an incubation period. So what are some of the symptoms that, you know, an individual should be looking out for?
Well, there are no detailed clinical descriptions which have been published so far. But again, from the reports of the exported cases, we know that cough, fever and shortness of breath are the main symptoms. And these symptoms have gone on for about 4 to 5 days. You know, so I think if you think you've got the flu, usually you get better within 2 or 3 days. But if it drags on, then it's time to go and see a doctor and, you know, go into a detailed travel and contact history.
All right, so, you know, do you think we're going to see an outbreak here in Singapore? What's the likelihood of that?
Well, you know, again, there's the best case scenario and there's the worst case scenario. In the best case scenario, I think we'll get maybe 3 or 4 cases and they'll all be isolated and contained and treated in the NCID as you described earlier on in the bulletin. In the worst case scenario, it's going to be like H1N1 and, you know, like 1 in 5 people is going to get infected. But hopefully, again, it'll be mild. And, you know, we'll deal with a few severe cases and everyone else will be immune to it at the end of the whole thing.
Professor Tambyah, thank you very much for coming into the studios to put some context to this developing situation that we're seeing with this Wuhan virus. We've been speaking there to Professor Paul Tambyah, President of the Asia-Pacific Congress of Clinical Microbiology and Infection.